Hello, my name is Dr. Vij. I'm from My Cancer Haven, and today in our Conversation with Cancer Experts series, we have a nationally recognized expert in leukemias, Dr. Nicholas Short, who's Associate Professor at MD Andersen Cancer Center, the leading cancer center in the United States. And he's going to talk about exciting new developments and how we incorporate non-chemotherapeutic approaches, Blincyto and Besponsa, into the frontline treatment of acute lymphoblastic leukemia. Welcome, Nicholas.
Thank you. Thank you for having me.
So, for our audience to put it in perspective, how are we doing today in terms of our outcomes for patients with acute lymphoblastic leukemia overall? And then we'll delve into the topic in greater detail.
So in many ways, some consider ALL to be a pediatric disease, and certainly it's more common in children. But certainly I'm an adult leukemia doctor, and so I only treat adults with leukemia. So in the pediatric context, fortunately, this is a very curable leukemia for most patients. So you can see on the left side here, these are the survival curves over time. And, really now in most types of ALL, we have, long-term cure rates essentially over 95%. Now, historically, we've lagged behind in the adult population, but you can see here that we have made some steady progress. Obviously, outcomes were very dismal before the era of combination chemotherapy and better supportive care and a lot of the new agents we have now. And in the more modern era, in the last decade or so, we can now get in patients above 18 years of age, long-term survival rates close to 60%. And actually, I think in the last several years, with some of the new therapies that we have, we're improving upon that. And I would argue that with most contemporary regimens, we can probably get long-term survival rates closer to 80% in patients between 18 to 60 years of age with newly diagnosed ALL.
So as far as adult ALL goes, I guess the algorithm starts at, is it Philadelphia chromosome positive or negative? For the Philadelphia chromosome positive, historically, outcomes had not been great, and we used